Hello to everyone. It's a great honor standing here. My name is Moran Bachrach and I'm a speech language pathologist and a PhD student. And today I would like to present to you a joint research conducted by Tanya Nitzan, a fellow speech language pathologist and a PhD student too in our lab, and myself on early joint attention abilities measured by the ADOS-2 and expressive language abilities in young autistic children, carried out at the Israeli National Center for Autism and Neurodevelopmental Research and supervised by Professor Ilan Dinstein, Dr. Judah Kohler, and Professor Gal Meiri. Before I begin, it is important to mention that I will be using language that refers to individuals as unique persons, reflecting their perspective that autism defines the entirety of the person rather than being something they have. Therefore, I'll use the term autistic children and not children with autism. But before anything else, I cannot continue without mentioning what we have been through in the past 2 weeks and to the parallel world that we all live in every day for a year and a half. So I would like to dedicate this short lecture to Shiri Bibas, Zichrona Livracha. Shiri, every time I embrace my children, the image of you wrapping yours in a blanket appears before my eyes and stays there. כי שירי ומשב הרוח, חלוני הפתוח, מעיין כוחי, צחוק ובכי, קץ יסורי, אתה בא והולך אליי, יהי זכרה ברוך. And now, in a sharp transition, speech delay is a common phenomenon in the general population, occurring in approximately 8 to 20% of children. However, among autistic children, it is known that around 85% exhibit language delay as one of the first symptoms. This is 4.5 to 10 times more prevalent compared to the general population. Unlike the DSM-4, with the transition to the DSM-5, language delay is no longer considered a distinguishing criterion for diagnosing autism. Nevertheless, due to its prominence, parents often notice that their child does not speak like other children in preschool years. In fact, for about 75% of parents, this serves as the first sign prompting them to seek for an evaluation. When discussing language acquisition, it is important to mention another key concept I'm sure you're all familiar with, joint attention. Joint attention refers to the ability of two individuals to focus and engage together in an external object, such as an item, event, or another person. It can be either responsive, reacting to another's attention, or initiative joint attention. Infants begin following others' joint attention cues during their first years of life, and this skill precedes language acquisition. Additionally, and importantly, deficits in joint attention are one of the early signs of autism. Following the discussion on language delays commonly observed in autistic children, we would like to highlight a specific group that we frequently meet as speech-language pathologists in clinical settings and in special education programs. Among the 85% of autistic children who exhibit language delay, 55% eventually acquire spoken language. However, 25 to 30 remain minimally verbal, meaning they either do not acquire spoken language at all or develop only minimal verbal abilities. Although minimally verbal autistic individuals make up approximately 30% of the autistic population, they have mostly been neglected in research. There are relatively few studies on this group, and in many cases, these children have been excluded from data analysis. We all know how essential language is and its long-term positive effects influencing cognitive abilities, adaptive functioning, quality of life, and mental health. And this raises an important question. What leads some autistic children to develop spoken language while others do not, despite receiving intensive and diverse interventions? What are the underlying mechanisms influencing this developmental ability? Cognitive abilities, early language skills, symptom severity. And of course, we weren't the first ones asking this question. Many studies have attempted to identify the factors that influence and predict language development, but most of them in mixed samples and not exclusively in minimally verbal samples. Cognition is considered a key predictor in most studies, as is joint attention. However, findings regarding social abilities in general and not joint attention specifically are mixed, and they have not been consistently identified as a clear predictor across studies. It is important to note that in most studies, joint attention measurement tools have limited to younger age groups and often require extensive time for coding, such as video coding methods. In our study, our goal was to identify different factors that may influence the language development of children were diagnosed with autism and are still nonverbal. By understanding these factors, we aim to derive meaningful insights for setting therapeutic goals. We wanted to understand what distinguishes those who eventually develop spoken language from those who remain minimally verbal. The children diagnosed in the units of the Azrieli National Center attended follow-up appointments once a year or every 2 years. This allowed us to track the development over time. In the current sample, we identified 101 children, all nonverbal at the time of diagnosis, time point 1. The children were classified by the language level at the second time point, after 1 to 2 years, with the goal of examining which characteristics of the children are associated with progress and what might predict their language development from the time of diagnosis. For example, ADA scores, social communication symptoms, repetitive behaviors, maternal education, and cognitive scores. The average age of the children at the first time point was 27 months. They were all Hebrew speakers, and 82% of them were males. All the children underwent EDOS assessment at both time points, diagnosis and follow-up. Our classification of language ability both at time point 1 and at time point 2 was based on a specific item, A1, from the EDOS diagnostic assessment. The children who were classified as minimally verbal scored at time point 1 score of 6 or 7, meaning having less than 5 words or no words at all. These I'm sure you all recognize, so just to remind shortly, the EDOS is a semi-structured assessment administered by clinicians to identify behavior characteristic of autism. While the DSM-5 is the gold standard for diagnosing autism, the EDOS is considered the gold standard for assessing the severity of core symptoms, and it is therefore widely used in most diagnostic centers worldwide. The EDOS is divided into 2 domains, social affect and restricted interpretative behaviors, SA and RB. Each domain receives a calibrated score ranging from 1 to 10, where 1 indicates the absence of core symptoms or minimal severity, and 10 indicates a high severity of core symptoms. In addition to the standard EDOS measures, SA and RB, we created a new item, joint attention, based on factor analysis by Katie Gotham and her partners, who were part of the EDOS development team. To the best of our knowledge, this factor analysis was not used for longitudinal research and measurement over time. Here you can see the items included in the factor analysis, 6 items that formed the joint attention measure, demonstrated by the wonderful girls of my colleague Tanya Nitzan. The first item from the EDOS was pointing. The second one was the use of gestures, gesturing. The third one was showing. Full showing includes lifting the object and presenting it to the adult, including the use of eye contact. The next item was initiating of joint attention by the child in order to show or share an interest with the adult. The fifth item was unusual eye contact. And the last item was a response to joint attention when the adult initiated the expression of interest by shifting his gaze. And here is a wonderful colleague, Danielle from the center, a speech therapist and EDOS tutor, demonstrating this. Before presenting our results, I want to share with you a short video of a young, typically developed child, the son of another fellow PhD student in our lab, Liora Manalis, demonstrating some of the items I have shown you, sharing, pointing, synchronized eye contact, and joint engagement, in less than 2 minutes of simple and daily interaction during EDOS assessment when he was only 1 year and 3 months of age. However, it is important to mention that this short video does not show full joint attention, which includes pointing to a distant object. Moran, Moran, And back to our study. In the division into the three groups at the follow-up, we conducted ANOVA analysis of the differences in scores at the first time point between the groups. Note that at the second time point, 50 children remained minimally verbal, 34 progressed to one-word phase, and 17 advanced to phrase speech. The following box plots illustrate the distribution of the data with the bold line representing the median. The x-axis represents the grouping at the second time point, 1 to 2 years after diagnosis, while the y-axis refers to the scores at diagnosis. In graph A, the y-axis represents cognitive score diagnosis. In graph B, it shows EDOS essay scores. In graph C, it presents scores for the newly created joint attention item. And in graph D, it displays EDOS RRB scores. It can be observed that only the social communication scores of EDOS the diagnosis and the score of the newly developed joint attention item distinguished between the language group assignment over time, whereas the nonverbal cognitive score and the EDOS RRB score did not, meaning the rich get richer. The children with better social abilities and joint attention diagnosis develop better language at follow-up. In addition, in a logistic regression analysis aimed to examine which characteristics predict language groups assignment at follow-up, we found that both SA in the first model and joint attention in the second model were the only predictors of language progression in a similar manner. Next, we aim to examine changes in EDO scores, SA and RRB, across groups between the first and the second time points. Surprisingly, there was no difference between the groups in the magnitude of change. All groups showed some improvements in SA score, but no significant differences were found between them. For RRB, the trend was reversed. There was a worsening in RRB scores, but again, this pattern was observed similarly across all groups. In contrast, when examining longitudinal changes in the new measure we developed, which uniquely assessed joint attention abilities, we found a significant difference between the groups in the follow-up. In other words, children who showed a more substantial improvement in joint attention abilities had higher language abilities at follow-up point. As a speech-language pathologist guiding clinicians in Beersheba through the OT Association, I experienced the intensive therapy with the children on a weekly basis. As we all know, while this work brings success, it also comes with challenges. This finding reinforced our belief in the importance of therapeutic focus on joint engagement and strengthening joint attention skills, as they ultimately contribute to language acquisition. However, it is important to note that we did not examine the specific therapeutic interventions that children in our sample received or their intensity. Our study concluded that both joint attention and social affect play a significant role in the development of spoken language during diagnosis, while changes in joint attention are associated with language acquisition over time. This finding is crucial for designing intervention programs where it's training to prioritize joint attention and social communication before working on language itself. Unlike previous studies, cognitive ability did not contribute to predicting language production group after 1 to 2 years, and we have a few assumptions why these were our results. One of them, the difficulty in reliably assessing the cognitive abilities of minimally verbal children and the lack of cooperation during such evaluations. Most importantly, we propose a simple and quick method for measuring joint attention, a metric sensitive to changes over time. Since this measure is based on a gold standard tool already widely used in clinic, it can facilitate tracking children's progress and may help to evaluate their responses to various intervention programs. Thank you all for listening. To Tanya, my amazing research partner, to our supervisor who guided us through the process and continuously refined our analysis, and of course to all the partners at the Azrieli National Center for Autism, the clinicians, research assistants, and last but most importantly to our families. This would not have been possible without you. Thank you.